I'm here with Mandy to talk to you a little bit about drains, why we use them, what they are, and how to manage them. First of all, drains are placed through the end of an incision or through a separate incision underneath the skin where I've been operating, because fluid will accumulate there in many procedures, such as a tummy tuck, and we want to get that fluid out so the healing will go on successfully. Now, the drain is composed of two parts. There's a tube and there's a bulb. This is the reservoir that the fluid will go into, and we commonly refer to this as a grenade because it looks like a grenade. The drain tubing has two parts. This white part is inside your body underneath your skin, and the plastic, the more transparent part, is outside the skin and connects what's underneath the skin to the reservoir. We want to show you three separate things to know about drains. The first is how to strip the drain in case there's something that's clogging up the drain. The second is how to empty and measure what's coming into the reservoir. And the third, Mandy will show you some tips on how to manage the drain by connecting it to your clothing so you don't have to be carrying it around all the time. So, let's start by stripping the drain. The drain is coming out of the skin, and this is where Mandy's fingers are holding it. Sometimes you'll get some small blood clot or a little bit of debris in here which clogs the drain up and doesn't allow the suction in the bulb to pull the fluid out. The way you can clear that is by something known as stripping the drain. You pinch it close to where it comes out from the skin, and then you draw this out towards the bulb, and then you release that, which creates a vacuum bringing this towards the bulb, and you can do this all the way out to the bulb. So basically, you're just squeezing it together and moving your fingers away from where the skin is, and then letting go close to the skin, and that helps move any debris or blood clots towards the reservoir. Now we're going to show you how to empty and record the fluid that's coming out of the reservoir.
Okay, during your pre-op we will discuss and go over drain care. You will see that the fluid is in the bulb. Basically what you're going to want to do, and you will empty this a couple of times a day. For the first 48 hours you can expect more drainage, and then over the course of a week it will start to taper off. This will always have a suction. Basically what you're going to want to do is you'll pop the lid. We give you a Dixie cup to empty the fluid into. You're going to empty the fluid into the cup. You can measure the fluid. It's got in milliliters, and we want you to record the amount of drainage that is coming out. And to close the bulb, all you will need to do is hold, keep the suction, and replace the lid. Okay, now I'm going to explain how to secure the drains. We're going to give you two of these clips included in your surgery kit. Basically what you're going to do is to wrap the clip around the plastic part of the drain, clip that together, and then you can use the clip to hold the drain in place by clipping it onto your binder. When you are showering, I also will give a little tip to my patients to get a shoestring, kind of run the shoestring through this, make a little necklace to kind of keep the drain elevated when showering.
These tips should help you manage your drains a little more easily. Drains are sort of a nuisance, but they serve a very important purpose. And we won't keep the drains in any longer than we need them to be there, but they'll be there as long as they're doing their work. Of course, if you ever have a question when you're at home and not quite sure how to manage the drain, always give us a call.